in Quebec, but also as a part of Canada, the labours are very powerful and they are very leftist-minded, socialist-minded. That is the reason why. And also the corporation, College of Physicians, they are very much against the freedom of choice in healthcare, against private healthcare. Also the medical unions, FMOQ, FMSQ, they were also against me. They were also against at that time. So everybody was against me because they wanted to protect their own private interests, their own interests. That is the reason why. And in Quebec particularly because of the special power of those labor unions.
Hello everyone. We are live from the St. James Club in Montreal, where the Montreal Economic Institute, together with the Canadian Constitution Foundation and secondstreet.org, is hosting the second edition of Putting Patients First. Today, we are taking a hard look at Quebec's healthcare system, a system that receives massive funding and endless promises, yet remains chronically dysfunctional. Waiting lists grow, staff shortages persist, emergency rooms overflow, access to family doctors is still limited, and costs continue to soar. Even major reforms like the creation of Santé Québec have been criticized for adding bureaucracy instead of improving care. Which brings us back to the same question. How can a system that costs nearly $64 billion a year still fail to deliver timely and accessible healthcare? To help us understand why and what can be done, we are joined by Dr. Jacques Chaoulli. His 2005 Supreme Court challenge questioned fundamental aspects of Quebec's healthcare model. And nearly 20 years later, the situation has not get better. Meanwhile, Premier Legault has just adopted Bill 2 under closure, expanding the state's control over how physicians practice. We will explore all of this today with Dr. Chaoulli.
It is because I was doing house calls in the public sector under Medicare and on a full-time basis with a car equipped with an emergency light by police authorization. It was quite helping the community. And all of a sudden, the government told me that you have to stop doing that on a full-time basis, otherwise we will cut 30% of your income. So I was shocked. And since I did not know anything about the law or healthcare systems, I ended up doing a hunger strike, which lasted for 1 month in the street of Montreal. And one person came to me on the street and told me, Dr. Chaoulli, you will be more useful to get off from the public system and go to do your house calls on a private basis rather than to let you die. It will be more helpful like this than let you die for the society. I picked up on his idea. I didn't think about that. So I put an end to my hunger strike after 1 month. I opted out of the Medicare system and I established a system of a privately financed house call system. And one day I got a call from a patient who was ready to pay the bill, big money for them because cash, and that person was on the welfare. So I asked the person, so you will get a coverage from your insurance? He said, no. I said, why not? He said, there is no coverage for that. I said, really? He said, no. I was shocked. And the colleague was doing the same thing on a private basis on the same area. And he never thought about the patient not being any refund. He didn't care, but I cared. So I studied the situation. I found out that prohibition of private health insurance. And then a friend of mine told me at that time that, Jack, not only the house call system problem. She said to me, there's problem of access in the hospital, in the clinics, to see an appointment to doctor. So I did the research on all that. And I ended up understanding that there's something to be done at the court against those prohibitions for the well-being of the people. Not only for house calls, but for the whole healthcare system. then I thought that I have to stop practicing for 2 years to study the law and to study healthcare system around the world to be able to start a legal case. And then my father-in-law in Japan, he put the bill to support me financially and my family for 2 years during the time that I was studying, preparing that one. And my father-in-law asked my wife, what wants Jacques to do? Would it be helpful for the people? My wife told him yes. He didn't ask any other question, and he paid the bill, paid the expenses for 2 years for me, just because to help the people. So I ended up to my action at the court that way, and with no lawyer. I had some lawyer, but they didn't agree with my interpretation of the Constitution, which was against the jurisprudence of Canada and of the United States. So the lawyers, they thought I was crazy and I would lose. Told me, you're crazy. Okay. So I did it alone. I found a patient who was a problem waiting list, was a hip, zeliotis. So he became my co-plaintiff. And since he was not capable to defend by himself because he was an old man, I picked up two lawyers for him, who defended him all the way, from the trial court to the Supreme Court. But I was the one to lead the legal argument, and I pleaded for myself. And so that is the way it happened to start the legal process.
How do you feel to see that you won, but it's not being applied?
Two conclusions. Number one, that the judicial system was not helpful, finally, because the judgment was only a declaratory judgment. It was not a court order. So the government was free to disobey, not to follow. And actually, the government did not follow. And also, I was disappointed from the political aspect, because no political party wanted to do anything about it, including Stephen Harper, who became Prime Minister of Canada. Before that, he was managing a think tank in Alberta. He came to Montreal, and he told me, very good what you are doing, I will help you, I will give you $1,000. I said, thank you very much. When he became Prime Minister, he refused to intervene anymore because he was subject to the powerful lobby. He thought he will lose in front of powerful lobby. So he bent, he didn't act. Maxime Bernier, before he was executive vice president of the institute here, he said after he became elected and he was in the cabinet of Stephen Harper. And Maxime Bernier told me, because I was close to him, he told me, I spoke to Stephen Harper at the cabinet, in front of the cabinet. He said, we have to do something now. Stephen Harper said no, for the reason I told you. So it shows you that the only way out of that is to giving back the power to the people, for them to make their own law against the interests of the politician, against the interests of the powerful lobbies. This is the only way. This is my conclusion. Mm-hmm. The only way. There is no any way around.
So we are seeing a health system across Canada that is not really working well. But why in Quebec it's worse than everywhere else in Canada? Why we are seeing our health system being so unfunctional?
In Quebec, but also as a part of Canada, the Labours are very powerful, and they are very leftist-minded, socialist-minded. That is the reason why. And also the corporation, College of Physicians, they are very much against the freedom of choice in healthcare, against private healthcare. Also the medical unions, FMOQ, FMSQ, they were also against me. They were also against at that time. So everybody was against me because they wanted to protect their own private interests, their own interests. That is the reason why. And in Quebec particularly, because of the special power of those labor unions. We were very active since the 1970s. Actually, since 1960s, but they have implemented in 1970 by threatening then Health Minister Claude Castonguay to kill him in 1970 if he doesn't enact the law to give them the monopoly, state monopoly, and monopoly to the labor unions. 1970. How I know that? Because Claude Castonguay told me that directly, face to face, because he had regret for what he has done. In 1998, he came up front without my call to the court as my witness, pleading in my favor, Claude Castonguay, 1998. And from there, he supported my action. Then I became close to him. That is why I asked him that question straight. Monsieur Castonguay, why did you do that in 1970? Then he told me the story. Nobody knows. It's a scoop I gave today in the conference. People they were shocked to hear that. They didn't. Nobody knew. I never said that to the. The reason why I said that publicly now today, I said to the conference, because I think that it was a question of public interest. That is the reason why I divulge, I speak out about that story that Castonguay told me. Because the public interest of the matter, that is the reason why I speak publicly, for the people to know. They have the right to know that one. Because the question is the public interest. I said, I'm sorry, Claude Castonguay passed away. He's not here to react and to defend by himself. I'm sorry about that. I respect what he did after supporting my action. But as a matter of fact, we have to acknowledge as a matter of fact that at that time he acted as a coward, bending in front of those threats. It was by cowardice. Things has to be named the way they are to learn for the future. That cowardice should not be a way to behave in society. Nobody should be coward as a general concept.
So you mentioned that our health system has multiple problems. You mentioned the politics, you mentioned the lobbyists, but if we are looking at the system in itself, where is the major problems?
The major problem is that the decision makers on how many doctors to be, what level of health expenditures to provide, is in the hand of the government and the associated lobbies. That is the problem. The problem is there. If you give the power back to the people from the institute, for example, they could make a bill of a law to propose to the people, several propositions, which will be good for the people, not good for the lobbies, but good for the people, not good for the government, but good for the people. People well educated could draft a bill to submit to the people for the people approval.
What are you doing when you have a major part of the population that is not well informed, and now that they need to take crucial decision like this?
Well, of course. While the people are not informed, there is no way around. Prerequisite is the people to be informed. You cannot succeed to give back the power to the people if the people they are not informed. This is common sense. But to inform the people, I don't think it is a so difficult task. In Switzerland, people they are informed. When they vote on the initiative referendum bill, they know what they are voting for. In Switzerland, on many aspects of the society, they made a lot of law. People of the Switzerland, they got informed. To inform the people, it's a possible task. Just do it, that's all. But organize society to do it, to inform the people. And the people, they will, especially in Canada, 85% of people under Ipsos, they want fundamental change in the healthcare system. They're ready. You know, when I had a voice when I was speaking in Canada, I know people that were supporting what I was saying. I had the support of the people at that time. Unfortunately, at that time, social media were not existent. So I could not build a network by the social media, through social media. If I could, I would have how many million of followers. Mm-hmm. But it was not done at that time, unfortunately.
So what we are seeing now, it's François Legault, who previously promised to make some major change in the health system, what he never did during his mandate. Now, he recently passed Bill 2 that is literally attacking doctors instead of attacking the system in itself that is not working. Yeah. Can you actually explain to the people what it means for the Quebec doctors?
It means that they will have, under the government ruling, to increase the volume of activity, the number of acts to be done, regardless of the quality of the care to be provided. They will have to reach a certain number of volume of activity. If if they do below, they will be financially penalized. So in order to meet this requirement, they will have to sacrifice the quality of care and to reduce the duration of a consultation in order to have enough number of consultations to be done on a given period of time. So that will be to the detriment of the quality of care about the doctors. About the surgeons, for surgery, operation, the government do not increase the availability of operating rooms. And still they oblige the surgeons to provide more surgery without providing the resources. So for the patient, what does it mean? The patient will not be better off because they don't have the capacity to increase the number of surgery because they don't have the resources. The government cut the resources. So the government cut the resources and they put the blame on the doctors.
What we are saying is some doctors want to leave the province.
Correct. Some doctors want to leave the province and the government want to prevent the freedom of those doctors to movement, which is that will be struck down by the court. I am quite sure.
Even with the non-withstanding clause.
No. The government, as I said before, the government has the power to ignore court decision. Yeah, they did that with my judgment. The government, they don't care about the rule of law here. So the characterization of the Canadian society to be free and democratic is wrong. When the government does not abide by a court ruling, it is not a democratic system anymore.
Because the population don't understand the money that go to the health system is about like $64 billion of dollars. We have less services. The services is not as good as it was before. And there is people dying in the emergency room.
You can call that corruption. It's a corrupted system. The money is diverted for those lobbies. They put the money in their pocket, one way or the other. It's a corrupted system. That's all. That is the reason why. Because in some other country with the same amount of money, they provide more services with the same amount, same budget. So here, why not? It's because the money is diverted. It's very simple to understand. Because the money is kept away by the lobbies for their own interest at the various levels.
I know you say like to give back to the people the power, but what would be one of the solutions if this one is not available?
Unfortunately, I don't see any way. I've been thinking about that for 20 years after the Supreme Court judgment. I did a lot of research since the judgment, a lot of research on political system. I wrote down in English, I didn't publish yet. If any publisher is interested to get my manuscript, I'll be happy to provide, to help again, to enlighten discussion, to help in discussion to how to modify our political system to address the needs of the people.
We saw during the COVID-19 what happened. We saw that some people wanted to have the choice to choose if they want to take a vaccine or not. And at this moment, we saw that some people were not allowed to work. They were penalized. They were treated as second-class citizens. And those people decided to take back their freedom. They went in front of the parliament. They protested for 3 weeks, asking the government to lift the health measure in order to get back to their basic freedom and be able to feed their family. We saw how some doctors were not allowed to talk or they would be investigated by the College of Physicians. A lot of people are mad at the doctor because of what happened, because some of them refused to speak out by fear, probably. And we saw people rise up, try to get back and get the power, and they got repressed by the government. As a doctor, what do you made of what happened during the COVID-19 era?
It's very interesting to see what happened in Sweden with the COVID-19. In Sweden, they didn't block the society. They didn't prevent people to interact or get out. They let the people free in Sweden. And I think studies have been done showing that there was no negative effect on the transmission of the virus COVID-19. In other words, it was not necessary to restrict so much individual freedom to address the issue of COVID-19. The example of Sweden speaks volume about it. What I would add to that is that COVID-19 was taken as an excuse and as an opportunity for several governments, Canadian, French, among others, to exercise more control on the society, on the people. It was an opportunity for them, the governments, to exercise control. The more a government exercises control, the more they think they can keep their power and justify their power by exercising control on the population. And that was a good example of what happened.
As you know, we don't receive any money from the government. We receive the money from you, and it's how we can continue to do our independent journalism. If you want to support us and you want to help us to continue our journalism, you can do so at rebelfieldreports.com. And thank you for supporting us and for watching us.